Welcome back to the Hour One Podcast. My name is Nima.
My name is Aaron.
And today we're joined by a very special guest, Dr. Antonucci, the CEO and President of Lee Health. Thank you for joining us.
Oh, thank you. Glad to be here.
Thank you for taking the time out of your day. We really appreciate that. Just for the viewers, can you just tell them a little bit about your role here at Lee Health?
Sure. I am President and CEO of Lee Health. And right now, Lee Health is the third largest public health system in the country. We have about 1,600 inpatient beds, a medical group, outpatient facilities, post-acute facilities. We really run the gamut, the entire continuum of care. And I've been in that role now for 3 years.
Okay, awesome.
How important is it for you to create and establish a culture between everyone that works here?
The establishment of a culture in any organization is really going to drive performance. You can have all the processes you want. You can have a great strategy. But as you've probably heard, culture will eat strategy 7 days a week. And so it's really critical that you establish a vision and you communicate that vision and help everyone in the organization see that vision and create that culture by what you do every day with your leadership style and with the style of the team that you build to be able to drive performance.
Yeah. So what are some of the short-term and long-term goals you have here for Lee Health?
Well, right now, as you know, we're in the middle of a COVID pandemic.
Yes.
So our attention has been really focused on that and making sure that we're delivering care to the community in a way that's compassionate and complete. And so I would say that in the short term, we're dealing with that. On the longer term, we're really looking at the change the way healthcare is evolving, moving more towards an outpatient delivery system to home-based care. And so we're really focusing on financial performance, obviously, no money, no mission, our coordination of care, making sure that care is across the continuum, excellent patient experience, and excellent outcomes. That's really our main focus over the next 3 to 5 years.
Okay. Talking about that patient care experience, I read that you guys are very patient-centered here, and that even when patients are discharged from the hospital, you provide a service of 30 days of providing meals for people who might not be able to have access to them. What makes you want to be so patient-centered? I mean, I know it's a health system, and but a lot of people are not thinking of those little things like the meals.
Yeah, healthcare is changing a lot, and things that didn't really resonate with healthcare systems in the past now are becoming very, very important. As we start looking at what happens to patients after they're discharged, will they become readmitted? Do they have an appointment with a physician for follow-up, et cetera? So these are things that are very, very important. And as you mentioned, one of the things we discovered is that patients were being discharged from the hospital and had significant challenges with food insecurity, et cetera. And we realized that those patients were more than likely to be bounced back in readmission or to get sick again. And so we realized that we have more responsibility than simply what happens within these four walls, that we have to start looking at other things that are going on in a patient's life, those socioeconomic issues that patients are dealing with, and where we can, we want to intervene and help.
How important is it for yourself to be, visible and have your presence felt around, when you're working?
As a leader, visibility is very important. I think the staff needs to know that you're there, that you're with them, that you've got their back, and you're by their side. Yeah. Having practice in this community helps because I've got relationships with many of the providers in the community, and they know me and have worked with me. But visibility is critical, and visibility in the community, not only in the health system, is important to really let the public know that this is their health system. Mm-hmm. Lee Health is owned by the public, and so as a result, they need to know that their leadership is out there present for them.
You mentioned you practiced here before, and you know a lot of people. How important do you think that role of being a physician in a CEO role, how do you think that plays? How important is it?
Being a physician, and certainly being a physician who's worked here, I think has helped me an awful lot. First of all, I understand the issues that the frontline practitioners are facing because I've been there. Number two, I've established long-term relationships with many of the physicians and many of the providers because I practice in this community. So for me, it's made an enormous difference in my ability to relate to the providers, both the physicians, the nurses, the nurse practitioners, the physician's assistants, and the entire staff because I worked side by side with them.
Do you suggest that as CEO, it would be better for you to have, been in the shoes of the people that are working under you? So, do you think that's a better?
Well, I don't know. I don't know that's better. It's worked for me. I think in reality, there are excellent lay administrators out there, people that do an incredible job running health systems. It's because they build a team around them. And as long as you've got that medical expertise on your team, you could be a very effective healthcare leader without being a physician.
It's like the saying of put yourself in my shoe type of situation, you know?
Yeah, I mean, again, it just gives me that ability to be able to relate to physicians without another person involved, without a chief medical officer, let's say. But it can be done either way.
How important is developing that team and having a diverse background? How important is that for you? And how important is it to be able to challenge each other in the way they think?
It's really critical. And one of the things about building a team is trying to get inputs from various sources. You want to have a balance of a homegrown team, people that have been in the organization a long time, with fresh blood, and bringing people in who have been at other places, because they can give you perspective and they can share ideas that came from other places. One of the important things about a team is having the right team dynamics. And being able to challenge each other and do it respectfully. I think sometimes people get defensive, and you gotta just really create a culture where we're talking about ideas. We're not talking about people. All right. So I like you, but I don't like your idea. Let me tell you why. And the ability to do that is really critical to move in the organization.
Prior to becoming to CEO, you were COO, and you worked closely with Jim Nathan, the previous CEO. How do you think that relationship with Jim Nathan was to make you a better CEO that you are today?
Well, the ability to work side by side with someone like Jim Nathan is priceless. You can't get that education anywhere in the world. Here was a leader who was in this community for 30 plus years, who, when he started, Lee Health was one hospital, Lee Memorial downtown, and you look at where the system is now that he's been able to shepherd. So the ability to work on a daily basis with him was invaluable in preparing me for being CEO.
So how do you keep yourself from becoming complacent in your role? Everybody goes through that fatigue, I guess, when they have a role. How do you keep it fresh?
Well, I think healthcare is one of those places where things are changing so rapidly that it's almost hard to be complacent, even if you wanted to be. The landscape is changing. The delivery system is changing. The nature of how physicians are working and practicing is different. The change that we've seen with electronic medical records in the past few years, all these things are happening so quickly that complacency, you don't survive if you're going to be complacent. If you're not willing to change the way you're doing things, you're going to go the way of Kodak and other companies that decided they didn't want to, change.
Yeah.
You mentioned technology and being innovative. I think that's one of the most important things of the health system, to always be up to date and innovative. How important is that for you guys here?
Oh, it's incredible important. I mean, I was just thinking about in the world of pharmacy and how that's changed from when my career, when the pharmacist basically sat in the pharmacy, doled out the pills and gave them to the providers. And then we began to see pharmacists on our units, in our emergency rooms, interfacing with our clinicians, being truly experts in the area of medication. And now they're making rounds in the ICUs. And the role has changed dramatically just in the last 20 years, I'd say. And we're seeing that innovation throughout healthcare.
You mentioned pharmacy. I don't know if you're aware, but we're fighting for provider status for pharmacists.
Right.
As a physician and now a CEO, what are your thoughts in regards to that?
I think I always relied heavily on my pharmacy colleagues, and I would always welcome phone calls from them. As I was prescribing medication, if I get a call and they would suggest something or a different dosage, or it was, to me, they were just members of the team that were trying to get the patient better. So I always welcomed it.
So what is your thoughts on advocacy for your profession and things like that? I feel like a lot of pharmacists, for example, we're trying to advocate for things, but how important is that, and how important is it to build relationships with other members of the healthcare team to get what you're trying to do passed?
Well, yeah, no person is an island, right? So, I mean, you can beat your head against the wall, but you're not going to get far. You can get much further by building coalitions and building teams and building support. So that if you're trying to prove your value, you've got to get people at the table to say, here's the value I bring to the table, here's why, and let's work together to advance that agenda.
So getting feedback, in school and throughout your career, you always get feedback from your friend, colleagues, whatever. Has there ever been a time where a friend or a colleague give you a tough feedback, and how did you dealt with it?
Yeah, I think feedback is interesting, right? Because we all say we're open to feedback, but when you get it, it hurts. And it's usually the first thing is a little bit of defensiveness. But then what you do is you kind of think about it, right? And you sleep on it and you wake up the next day and then you change, right? So I think that people who are willingly giving you feedback is a gift. Because the worst thing is if they don't give you the feedback and you continue to work in a way that maybe isn't as efficient and you're not achieving what you want and you don't really know how you're coming across. Something that I stress with my team all the time is that if you feel that a message you've delivered wasn't received properly, it's on you. It's not on the person receiving. Well, he didn't understand what I was saying. Yeah. She didn't get what I meant. That's on you. It's your job to make sure that your message is received the way you want it to be received.
As a CEO, a lot of people look up to you. To do, how do you build that relationship, I guess, with your team for them to be able to give you feedback without, like, trying to hold back because you're their boss?
Yeah, I mean, one of the things, one of the casualties of being a leader is the loss of truth, right? People don't want to tell you the truth. Yeah. And the way you combat that is to be open and transparent, to admit when you've made an error, to admit, say, I was thinking this, but it's not right. I think we need to go in a different direction, and letting them know that you're willing to change your mind and to do something differently. So it's really about that transparency and openness.
So how important is treating your colleagues, patients, and anybody at your level with the respect and professionalism? Because you just talked, like, being able to give advice, being able to critique people, that matters. But those relationships have to be built before. So how important is it to treat everybody with respect?
It's incredibly important. I mean, everybody in this organization plays a critical role. I've spent a lot of time, when I was COO, I used to take a day a month, and we had a thing called Where's Larry? And I would be working somewhere in the organization. And I scrubbed toilets with the housekeepers, and I transported patients. And when you do stuff like that, you realize that everybody in the organization plays a critical role. Awesome. If the transporters stop working, the place grinds to a halt. Yeah. If the housekeepers aren't doing their job, the infection rates go up. We can't turn rooms over. People are stuck in ED. Everybody plays such a critical role, and you gain such respect for those folks by working alongside them. And when they see you working alongside them, you get their respect, because respect is earned. It doesn't come with the title. Yeah. A lot of people in high roles don't have a lot of respect because of the way they may behave and the things they say. So you got to earn respect, and you got to give respect.
In your first year of being CEO, what changes have been implemented at Lee Health?
Well, we've had a lot of differences. As I said, this is my third year in the role. When I came on board, we had some issues with our quality ratings, and we were very concerned about them. And so we created an entire process to be able to look at that and evolve. And so now our hospitals are all Leapfrog grade A hospitals. We've received an A grade for Leapfrog. Our CMS star rating has gone up. We've eliminated all Medicare penalties for hospital-acquired conditions. It really took a lot of focus and building a team that understood how important it was, and having the support of the board, we were able to turn that tide.
So, like you mentioned, now you're at the top of your game. Is it hard? Is there pressure to stay, keep getting that level A every year?
Well, that's what they say, right? It's easy to get to the top, but it's hard to stay at the top. Yeah. So I think it's a matter of continuing to be focused on what we're doing and not being complacent about those things. So patient safety and our staff safety is our number one value. So we're constantly beating that drum.
So have you ever stepped in, I guess you're just talking about a challenge. Have you ever stepped into like a situation where you knew the challenge was going to be difficult? And how did you deal with that?
Yeah, I can even think back to when I was a practicing physician and I ran a physician's primary care. We set that practice up in the mid-90s, and we brought a bunch of practices together and created a group. And one of the decisions we had to make was to buy a computer system for this new group. And we did our research, and we invested a significant amount of money in this computer system. And within 6 months, we realized that we had made a mistake, that this wasn't the right system for us. And we had spent a lot of money. I think it was close to $500,000 on this system. And so I had to go to my physician partners and say, look, here's where we are, here's what we need to do. But again, it's being open, transparent. Not every decision you make is going to be right. True. You're going to make some mistakes along the way. And what we say here is, you got to be innovative. You got to take some risks. And if you're going to fail fast and move on. But that's, you just got to be open about it.
As CEO, I feel like you have to have some sort of entrepreneurship in you to be able to be in that role. What's your favorite metaphor to describe entrepreneurship?
Gee, that's a tough one. To me, it's really about the leadership, right? And it's about seeing something, having a vision, and saying, why can't we do it that way? Why is it that this is the way it's always been done, and not falling into that trap, and being able to look outside that and say, wait a second, maybe there is a better way. Let's work through it. And recognize that what's the best way today might not be the best way tomorrow. So constantly be moving along that road of continuous improvement.
When you started here at Telehealth, did you ever have in the back of your mind, like, I want to be the CEO? Was that ever something on your mind?
It really wasn't. My history in leadership is very different, I think. Okay. I came here in 1983. And I joined a physician in practice. I practiced obstetrics and gynecology. And I did that for 20 plus years. And I was involved in the formation of physicians' primary care. And I thought I would be doing that. I'd be practicing and running that group. And it wasn't until 2007 that then CEO Jim Nathan called and said, we'd like you to take over one of our hospitals. And I was flattered. And I said, well, Jim, you realize I've never run a hospital before. And he says, yeah, but it's the same skill set. You manage people. And so back in 2007, I had to make a decision. Do I give up a 24-year practice to do this when, as a practitioner, your only real asset is your patient base? Yeah. And when you walk away from a patient base, it's gone within 6 months. So, I had the difficult decision. Is this something that makes sense? And I thought about it. And I said, I've got the ability to affect healthcare in this community in a much bigger way than one patient at a time. And maybe this is an opportunity. And not everyone hands you hospital every day. So I decided to do it and came on board at Cape Coral Hospital and ran that for a few years and then became chief operating officer and then gradually increased my responsibility. And then in 2017, the board appointed me as CEO.
So if you had that same offer, would you make the same decision that you made previously?
Yeah, it's been an incredible opportunity, an incredible ride, and to see the changes that have occurred in healthcare and this community, to be a part of it, has been fantastic.
Do you miss being a physician? And would you go back after, maybe after you're done?
I get asked that a lot. And one of the things that's interesting is by staying in the community, it's really helped because I get to see patients all the time. Mm-hmm. When I'm in Publix, a patient will come up and bring their, college-age child and say, you delivered him or her, and awesome. And which is phenomenal. I think if I moved to a different community, it'd be a little harder, but being here has really helped. So I still get to connect a lot with patients.
So when you were growing up, what did you want to be when you were growing up? I'm assuming most people don't wake up and I want to be CEO of a hospital.
Right.
What did you want to be?
Well, when I was really young and in school, my favorite subject was math. Okay. So I just wanted to do math.
We're different there. Okay.
Yeah. So when I went to college, I was a math major. Okay. And it was in my third year of college that a guidance counselor said, well, what do you plan on doing? And I said, I don't know. He goes, well, do you want to teach math? Because there's not much you can do with math other than maybe teach, or this new thing called computers, which, we were still using calculators and slide rules back then. So I said, well, gee, I don't know. And then, in the back of my mind was becoming a physician. Okay. But something that's somewhat humorous is that I would pass out at the sight of blood when I was younger. I mean, to the point that even like in college biology, when you prick your finger to check your blood, I passed out. Oh. And so I said, well, I can't be a doctor.
That inspired you.
Yeah, no, I can't. It's not going to happen. And then I spoke to some folks and I says, oh, no, don't worry about that. You'll get over it.
Don't
worry, it'll go away. And in fact, it did. And, so yeah, I was going to be, I just loved math. I mean, so then what I did is I started to take my pre-med prerequisites and applied to medical school, went to medical school in Miami, and then did my residency up in Virginia, and then wound up here. But yeah, I didn't have any, until rather late in the game, I didn't really have that dream to be a doctor.
Yeah.
And then certainly once I became a doctor, I thought I would just be a practicing physician my whole life. I had no aspirations for leadership. Back in the 90s, I decided to go back to business school and get my MBA, not so much with an idea of getting into healthcare leadership, but really for my own learning and for my own practice. I had at that point a 5-physician practice, and I knew very little about accounting and finance, and I felt it'd be worthwhile. And it was at that point that PPC was being brought together, and they asked me, would you take the lead there? And so that's how it happened. And then from there, here I am.
You've been a leader for many years. I'm sure when you were back in school, you were a leader. How's your leadership viewpoints changed in, let's say, the past 15 years?
I think that one of the things that's unique about my leadership style is I'm very collaborative, and so I'm not dogmatic or autocratic. I really want to hear what my team is thinking so that we can make a decision and move together. And I think as you gain more confidence, you become more open to listening to other ideas. And so I always want my team to be able to put everything out on the table to discuss it, and we can argue and we can fight about it, but then once we decide we're turning left, everybody's turning left.
Prior to this question, you mentioned you got your MBA after. So I guess to the physicians or anyone in the healthcare world that's listening, how important was that MBA degree? Do you need that MBA to be in your position?
I don't know that you need it, but it really does help. One of the things that you're having to do consistently in this type of leadership role is interfacing with attorneys, accountants, finance people, economists, et cetera. And understanding the language, if nothing more, makes a big difference. So it's really been very, very helpful. The other part of business school, or the softer side, or the organizational development, organizational behavior, those types of courses, I think really helped me as I moved and navigated my way through leadership.
Do you think you learned a lot on the job?
Absolutely, yeah. I think you only learn so much in school,
only so much
to me,
we always speak about that.
Right? It's almost like in school, what you're learning is the language, and then you have to go out and apply it. And I think that's how I would describe it. And I think that, as I mentioned before, working for 10 years with someone like Jim Nathan, it is more of an education that you can get in any book.
What do you think is something that, when you first stepped into the role, something that you weren't taught and you learned on the job? What was that thing that the job taught you that school didn't teach you?
Of relationships and the critical importance of relationships. You can see a name on a piece of paper and you can call that person and say, hey, I need A, B, C, or D. Can you help me with this? But if you don't have a relationship with that person, it's a different ball game. Whereas if you've established a relationship and you can call and say, hey, Jack, here's where I am. Can you help me out? It makes all the difference in the world. So I think that's the one thing that you learn right off the bat, that you got to have solid relationships with folks.
In terms of your professional career, is there anything you would have done differently that, any decisions you made, anything like that? Is there anything you could go back to and you'd be like, I'd redo that?
I can't really say that because everything that happened to me happened at a particular time at a particular place. And it was a matter of making a decision. Yeah. And one of the things I always share with young folks, regardless of where they are, is it's okay to have goals, but don't get so blinded by the goal that you miss out what's in the periphery, because you could have a goal to be somewhere and go somewhere, and then an opportunity presents itself. And if you're blind to it, you could miss out something dramatically. Sure. And that's exactly what happened to me. As I mentioned, my goal was to be a practicing physician and maybe run a small group. But these opportunities presented themselves. And when they did, I considered them and in many cases took some risks, which you have to do if you're going to succeed. Yeah. And they worked out for me. So I really don't have any regrets professionally.
Oh, that's good.
You just mentioned previously how a name on a paper is different than the relationship. The relationship is what builds it. How how do you go about hiring? I guess when you first get the resume, you're looking at a resume. You don't have a relationship.
Yeah.
Right.
How do you go about looking at a resume? I guess getting that.
Yeah, we do a couple of things when it comes to hiring, especially leadership roles. We have a pretty extensive interview process. So we'll bring people in if they're going to be in a senior leadership role, for instance, and we'll do a number of rounds of interviews. So they'll meet the entire leadership team. We'll do some group interviews. Many times we'll bring them back and have them have group interviews with the team that they might be leading, whether it's a pharmacy team or a nursing team. And there's something that we also do is we do psychological evaluations on all our leaders. We have a company that we work with in Minnesota that does very detailed psychological studies on folks, because not necessarily to find out if they're imbalanced, but to determine whether they're a fit for the organization. Because this company knows us very, very well. They know our culture, and they will tell us, this is a smart person, but I just don't see them fitting in, and they give us that advice, and that's very, very helpful. But the motto is hire hard, and so you don't have to let people go later on, because firing people is tough.
So obviously with COVID-19 situation, we're dealing with it with school. A lot of things are virtual. They don't even know if we're going to have in-person classes.
Yeah.
How do you think that's going to affect the incoming physicians where, you're learning about a bunch of stuff on the internet rather than that in-person? Do you think good, bad? Where's it headed?
I think there'll be some definite catching up to do. One of the things about medical school is that your last year is an elective year, and so you can do a lot of different things. But I think residencies, as you get into your residency, there's a lot of duplication in what you do. So I think folks are going to be fine. They might be lagging a little bit when they first start out, but it truly is amazing what you can learn now remotely and otherwise. But the relationships will come back. As you begin working with patients, that'll all come back.
So how has COVID-19 affected the way everybody's practicing care here?
There's been some really dramatic changes. One of the ones is with telehealth. We started a telehealth program a few years ago, and it was modestly successful. We didn't really push it real hard. We didn't know how the community would feel about it. It was one of those things. So we were doing probably 6 to 10 telehealth visits a day within our system. When the pandemic started, we realized we'd have to crank that up. So we built the processes where we can make it available to more physicians so they can use it. And what happened is that we wound up doing about 1,000 visits a day. We went from doing a handful to doing 1,000 a day. It was truly amazing. And one of the things we did for the community is we made it free, because our normal fee for telehealth, I think, was $49 a visit. But in the early days of the pandemic, we said, look, it's going to be free to the public. Anybody who wants to use it, anybody has a concern, who wants to be tested, et cetera. We did that. And even after we put the price back on, our use within Epic, with our Epic providers, is still ranging near 1,000 visits a day. So it's changed basically overnight the way people are accessing healthcare. And of course, it's not useful for every type of visit, but we know that a lot of visits, it works very, very, very well. The estimates are that 50% of primary care visits can be done through telehealth, and probably 80% of behavioral health visits can be done that way.
So it seems like the second wave is kind of coming in right now, and things are opening back up. I don't know if you want to answer this question. You cannot. But do you agree with things opening back up, and also on how is Telehealth dealing with the second wave of
Yeah, I think one of the things we've got to recognize is that the community had to open up. I don't think we had a choice. So it's the question now is, how are we doing it? And if you look at the wave, the first wave was a pretty steep wave. If you look at the slope of that curve, it was going up pretty quick. Yeah. Then we had a dip down. And then when we started to open up, we began to see the slow increase. But the increases that we're seeing now are pretty linear, whereas before they were exponential. So we knew that as we opened up, we would see more cases. The whole issue of flattening the curve was so that we would be able to manage the patients, that we wouldn't get overrun. Right now, we're in good shape. We've got enough personal protective equipment. Our capacity is still in the 70% range, 70s. So we're managing it. what we have to watch now is how steep is that curve? Is that curve going to turn up really quickly, which will be an issue for us, or is it going to continue to slowly increase linearly until we have a vaccine and be able to knock this out? So we are managing it. We're in good shape here with regard to our beds. We've got a surge plan in case we start hitting capacity. We have the ability to convert certain areas that are non-intensive care to intensive care. So we're just watching it every day.
Perfect.
So what advice do you have to the community for staying safe?
The most important thing is to wear masks, social distance, good hand washing, the things we've been told from day one. I'm really concerned that we're not doing it in the community as much as we should. I was out this weekend and in various stores, and probably 30% of people were masked, and that's what's worrying me. I think that if we open up, we can open up safely if we just pay attention and practice good safe practices. We'll be okay.
Yeah. What CEO hacks have you developed throughout the years?
CEO hacks. I think one of the
you don't want to give away secrets.
No,
okay.
no. I think there's a couple of things that I live by, and one of them is to think about what is it that your staff is looking for in a CEO and a leader, and it's 4 things, and I keep this on a sticky on my computer. It's trust, compassion, stability, and hope. Your team has to trust you. They have to trust that you're going to do the right thing for the organization. You've got to have compassion and a personal relationship with folks so you really care about them as people. Stability is so important, right? When the world is falling apart, you as a leader have to maintain that focus and stay calm. And then no matter how bad things get, you got to provide hope. You got to provide an answer to say, here's I know this is bad, but we can get through this. So that's one of the things that I really live by. And I also remember something that my dad used to tell me when I was a little kid. And he had this saying, he used to say, a fish thinks from its head. And I always think about that when I think of leadership. So I'm wary of that. And I say, look, I've got to do a good job. I got to be out there and present myself well because I represent the entire organization.
So even before when you were in CEO position, I'm sure you talk to people. What is the biggest myth that's related with the CEO position? Is there anything you overheard and you're like, oh, no, it's not really like that?
Yeah. I think people think that when you're a chief officer, whether it's a chief operating officer or a chief executive officer, that you know everything that's going on in an organization.
Sure.
And, in an organization with 14,000 employees and 4,000 volunteers. And
well, you guys don't have a group text?
Yeah. And people come up. I had someone call me yesterday and said, I went to the convenient care over on such and such, and it was closed.
It's like,
I said, oh, okay. I didn't know that.
Thanks for letting me know.
Thanks for letting me know. But yeah, that's one of the myths about being in a senior level. And you can't know everything. Yeah. You've got to rely on your teammates. You've got to rely on folks that you can trust. And you got to leave them alone and let them do their job. And then check in with them and provide them that guidance and governance. But you can't, you're not really running an organization. You're just kind of overseeing it.
So how's it important for you to not micromanage your team? Everybody has different leadership styles, but for you, I'm assuming you don't like to do that. So how important is that?
No, I really don't. And I think that you achieve so much less when you micromanage. One of the things that I've learned is the people that are doing the job have the answers. And frequently in an organization, what happens is that as problems evolve, they kind of work up the chain, right? And so you have a problem, and if the front line can't work it, they go to their director, and then the director maybe can't work it out, and they go to the chief. And now you've got somebody in a position who has no idea what the work is, really. Exactly. Creating a problem, creating a solution. So that solution then comes down, and by the time it gets to the bottom, the workers look at it and say, that's the craziest thing I've ever seen. That doesn't work. And so you go through this cycle. And so I've always been focused on letting the frontline workers solve the problems, right? Just to give you an example. So, in the emergency room, for instance, you've got a problem between the nursing staff and radiology, right? They can't get patients back and forth. So what happens? The nursing supervisor speaks to the nursing director. The radiology supervisor speaks to the radiology director. So now the two directors get together and they try to solve this problem. And my solution is no, let's bring in the nurses and the rad techs together and solve the problem.
Makes sense.
They'll figure it out. But it's things like that, I think, that you learn and so-called hacks. I mean, that's really it.
So if a magazine or newspaper comes to you, they have a section on the magazine they want to start, Life of a CEO.
Yeah.
How would they write about your life in the magazine?
Well, it's a 24/7 life. I think you have to accept that.
Okay.
I think one of the changes that I recognize from going to be a practicing physician into this type of role is that when you're a physician, you're really working hard and you're busting it. But when you're off, you're off. When you turn your beeper off and you hand it over to your partners, you're pretty much okay. In this role, it's 24/7, 365. So whether I'm on vacation somewhere or not, I'm still answering calls, answering emails, responding to issues. So I think that's one of the differences that I think you got to be ready for. And I think that if a magazine were to follow me around, they would see that. It's an early day. As soon as you're waking up, you're checking the status of the system, looking at your dashboards, responding to emails that may have come in over the night, and then you're out and about. You're meeting with leaders. You're out in the clinical areas, talking to the folks. But it's and it's a lot of evening work too.
Is that something you had to get used to, or were you prepared mentally when you got into it? That I'm expecting this.
Yeah, I think one of the things that helped me was being an OBGYN. Right. I worked day and night for a long time. So I knew it would be that way and I expected it. One of the things that some people don't expect is the social side of it. Being the face of the system, you have to go to a lot of social events, a lot of fundraising events. Yeah. So that's something that if you don't like doing could be a challenge for you.
How important is work-life balance for you?
It's critical. I think that when I find myself not taking care of the life side, the work suffers. You can see it. You get burnt out. You can start to feel that. So getting proper exercise and rest is critical, and having good relationships is critical to success.
When was that one moment where you went home one day, looked yourself in the mirror, and you felt accomplished?
That's a good one. During my clinical career, there were many times where you just really felt good about what you were doing. And the difference is when you're in a clinical scenario, you're dealing with a situation that's right in front of you. You deal with it, you get an outcome, you feel great about it. In a management type of thing, you're working on projects for a long time. And so that all the work you do may not come to fruition for quite some time. But when it does come, it really feels good. And we see that in a lot of things in healthcare, whether you're managing an organization through a hurricane, for instance, which is a phenomenal thing that
let's cross
happens.
Our fingers that doesn't come.
Yeah, exactly. But when we had Irma here, we had 8,000 people, staff members and their families that we put up in our hospitals so they would be safe, including their pets. So you look back on that and you say, wow, that was really something, and the team really came together.
So before this, what made you actually want to become an OBGYN? Especially you didn't like blood, so.
Yeah, I know. Well, as you get through medical school and you're working through the various rotations, I enjoyed the aspect of OBGYN for a couple of reasons. One, it didn't have the separation between a medical and a surgical specialty. True. It was both. Whereas true. Everything else you had to choose. I'm either going to be a medical doctor, like an internist, or I'm going to be a surgeon, like a general surgeon or orthopedist, et cetera. OBGYN gave you the ability to have relationships with patients, to be their primary care physician, but at the same time, be able to do their gynecologic surgeries. And of course, the joy of obstetrics was something that appealed to me. I tended to enjoy working with younger, healthier patients. Okay. I wasn't I didn't love the intensity of the ICU and the stuff that went on
Okay.
there. That just didn't appeal to me as much as OB. So OB gave me a great mix and the ability to do both medicine and surgery, and at the same time have relations with patients and not just do something and then
Yeah.
never see them again.
If you were to just get a call today and like, Dr. Antonucci, you don't need to come to work today, what would you have done?
If I didn't come to work today,
Yeah.
When does that happen?
yeah.
They're like,
Well,
"Yeah,
that's
it's okay, take the day off."
That's like a dream. I would probably spend the day practicing guitar.
Oh, okay.
okay.
You play? Okay.
I just started a couple of years ago. It's one of those things I always wanted to do. So I started to take lessons a couple of years ago.
So you got to put on a concert for us one day.
No, I'm not.
We'll
that
come
good.
back with the
I'm not
camera.
good enough.
Let's not do that.
No, you don't want to hear that.
I play the violin, so we could do it.
Oh, do you really? Oh, yeah. But no, it's yeah. So I mean, I enjoy doing that, and I enjoy biking.
Okay.
And so it's good.
So if we were to go back to your high school and
Mm-hmm.
undergrad, you said you went to University of Virginia,
Actually, University of Miami, and then Eastern Virginia.
Eastern
Yeah.
Virginia. So if we were to ask your colleagues and friends, who is Dr. Antonucci? What would they say?
Back in high school, it was interesting. I was sort of one of those middle guys that got along with the smart nerds
Okay,
and
okay.
also the athletes. I had friends on both sides of the spectrum. I wasn't a varsity athlete or anything like that, but I could play
Yeah.
stuff, and but I was really good in school too, so I got along with them. So I think they just kind of say an all-around nice guy, you know? Yeah.
So when everything's all said and done, what do you want to be remembered for? Like your whole career, what do you want to be remembered for?
I would like to be remembered for someone who wanted to change healthcare in a positive way and wanted to make Lee Health the model for what healthcare could be, but also to be a person of integrity, someone who, when they said something, you could take it to the bank, and to be a great husband and father.
So class of 2020 obviously didn't, around the country, some around the world, didn't have a graduation.
Yeah.
If you would send a message to the class of 2020, Florida Golf Course is right here.
Yeah.
What would be your message?
Well, specifically about that is that don't get hung up on that the fact that you missed out on it, because everything in life has a reason, and it may not be obvious to you now why something like this happened, but someday it will, and don't let this be a damper. And there'll always be time for a party, but use it to move your life forward.
So in our first interview with Dr. Crennan from Cleveland Clinic, he mentioned something that stuck with us. He said a bias for yes. He has a bias for yes. He never says no.
Right.
Always say yes. What is your viewpoint on that? And when do you think is the right time to say no? Because if you keep saying yes all the time,
Yeah.
you're going to be a CEO.
Right.
Thank you for saying yes to us. We appreciate that.
Yeah. No, I think a bias for yes gives you a openness to possibilities, and I think that's what he was referring to. So if someone brings something to you, don't think about why you can't do it. Think about why you can do it. And if you find out that you can't, that's when you say no. After you've done the due diligence and you've really studied the issue and studied the problem and studied the possibilities, if it's just not going to work, that's when you have to say no. But I was never good with someone who said no right off the bat, because it just shows that they hadn't really thought through what I was talking about.
Was there ever a situation where, someone brought something to you, whether it could be now or 15 years ago, 20 years ago, where you weren't good at it, but you were like, went ahead with it, and how did you deal with it, and what happened?
Well, I think the issue that you have to do is when you're coming up with a new process, problem, challenge, I think you've got to set the steps in place to make that work. Say, okay, where are we today? Where do we want to be? What are the steps that we need to pass through to get there, and what are the time frames for that, so that as you can check yourself along the way, you can say, okay, we said we were going to be here at this point, we're not. So what does that mean? Do we need to change how we're doing it, or do we simply need to pull the plug and say we're not going to get to the next step? But if you break it down and make big small, I think you can manage those issues.
So we're going to be interviewing Dr. Marshall. He's the Nobel Prize winner coming up, and he mentioned something that stuck with it. He said, when someone asked him, when is the right time to know that this job is not for you?
Yeah.
How would you answer that? Like, when is the right time to know, I'm not really built for this?
Right. My experience has been is that it happens pretty quickly.
Okay.
And it's not unlike when you hire someone. I would say within the first 3 months, you pretty much know whether that person's going to work out or not. And I think it's the same thing with a position. If you find yourself in a position and it's just not feeling right, rather than drag it out, sometimes it's best just to make the move and do something different.
So when you're hiring somebody or you want somebody to be a part of, your leadership team, what are some things you're looking for? What are some qualities you're like, I want somebody like this on my team or on my staff?
And I tied on to that. What is that thing that you think is missing nowadays that you're looking for that you don't see often?
Yeah. Well, number one, it's integrity and openness. And again, it's that ability to have someone tell you the real deal and not be making stuff up. And the honesty and integrity to be able to say, I don't know. I would much rather someone say, I really don't know. Let me find out, or than just make something up. Because when I'm in the middle of a busy day and I ask someone, hey, what's the status of this? And they tell me information that's not correct or that they think it's this way and it's not, that hurts me, and it hurts the whole organization in the long run. So it's that ability to be able to say you don't know, and that's hard. It's hard to tell your boss you don't know,
Honestly.
because you want to make sure that you know everything. But I tell you what, a leader, a good leader, and a good boss is going to appreciate it. If you just say, let me just get back to you on that, I'm not sure.
So you're a CEO of a big establishment. Not everyone's going to be able to sit down one-on-one with you. If someone's trying to get hired here, physician, any nurse, what would be the best way for them to catch your eye? So for them to be like, for you to recognize them.
Yeah. Well, I think obviously it starts with something on paper usually, whether it's a resume or a letter. Sometimes a letter can do it. A lot of times it's a personal connection. I get a lot of personal connections from. Again, it's about the relationships, and if I know someone's. If I know someone that I trust who says, hey, I met this person or I got this person, and I think you really should talk to them, that goes a long way.
Perfect. So if you were to sit in our shoes, what would you have asked yourself that we didn't ask you?
I think you've done a great job, first of all.
Thank you.
You've covered a lot of territory and asked a lot of great questions. I think one of the things that people really want to know about is, what does the future hold, and how do I see this whole situation, not only with COVID evolving, but healthcare in general. I mean, we've got some real challenges ahead in healthcare, and you know it and you see it, especially in your field with the cost of prescription drugs and what's happening there. And so I think we have to really look at ourselves as a society and say, what is it? What do we expect from our healthcare system? Is it a right? Is it a privilege? If it's a right, how do we make sure that everyone has equal access? Because right now, we just have to admit that that's not the way it is.
Yeah.
We know that there are a lot of folks that just do not have access to care, and their outcomes are worse. We're seeing that with COVID now. There's nothing magical about COVID. It's just bringing out the things that we already know about a healthcare system that's not geared for everyone. So I think that what we really need to strive for is to come together as a community and as a society to say, these things are wrong. How can we work together to fix them? Because the bottom line is we're paying for it anyway. But I bet we can do it in a more efficient way with a better delivery system.
How do you think we can solve this? If you have an idea, how do you think we can move forward?
Yeah, I think it really comes down to building a delivery system that's not based on the current environment of kind of fee for service. The more you do, the more you make type of thing. And really looking at healthcare organizations to focus on, how do we keep a population healthy? How do we at Lee Health keep the people of Lee County healthy and out of emergency rooms and out of ORs and out of doctors' offices? And can we build a system that does that? And then how can we pay for that system?
So moving more into preventative medicine versus
preventative
treating.
medicine, right? Risk-based medicine, where the health systems are at financial risk and not third parties. I think a system can be built that can work.
So what is your last message to the people watching, and also to your community, Lee County?
Well, first of all, I just want to say how proud I am of this community and what it's done recently through the COVID pandemic, and this incredible staff and what the work that they've done from day one. I mean, we were hit with this. Our first case was March 7th. It's been a little under 100 days now, and they have just stepped up and did remarkable work. So I want to thank them for that. And I just want to ask the community to continue to be cautious moving forward and realize that this is not the way it was before, that we're in a new normal, and we're going to be that way for a number of months until we get this thing licked. But we've got to keep each other safe.
Perfect. Well, thank you so much for taking the
Really
time to sit down
appreciate
with us. We know you're really busy and we're middle of a pandemic, so we appreciate it.
Oh, it's my pleasure.
Thank you so much.
It was great.
Thank you for everyone watching. My name is Nima,
My name is Aaron.
and thank you for accepting our invite.